Hi, I'm Sarah Macias here with Scott Gladish from SFUR to answer a few questions for AROC's Company Spotlight. Welcome, Scott.
Thank you.
So tell us, how did you get introduced to the non-subscription industry?
Well, 3 years ago, we signed a very large national retailer who uses our bill analysis, negotiation, and settlement services. And one of the states that they assigned us was Texas. So that's how we were connected.
And how were you introduced to AROC?
Google. I mean, once we received the assignment and we knew we were going to be working in Texas, I took responsibility to research as much as I could. And during that research, if you Google Texas Injury Benefit Plans, you're going to find AROC. And I did, and I noticed that our client was an AROC member, so I contacted them and they put me in touch with the AROC leadership.
So tell us about your company.
Well, we're a 35-year-old healthcare services company. We leverage the medical knowledge of the physicians and nurses that work for us. We have a peer review network of over 600 board-certified physicians. We do peer review for hospitals. On the payer side, TPAs, carriers, insurance carriers, large employers, ERISA plans. We do utilization review, case management, disease management, population health, analytics. Our biggest line of business, expert medical witness, peer review. But our biggest line of business on that side is our bill analysis, negotiations, and settlement work. And that's what we're primarily focused on here in Texas with Texas Injury Benefit Plans. Through that process over the last 2 years of working those bills, working thousands of bills for our clients, we have developed relationships with over 400 Texas hospitals who have really embraced and been supportive of our evidence-based medicine approach to bill analysis and negotiations. And what we do that I think is unique and special is we really take the time to investigate bills. We have a team of physicians who are certified medical coders, and we go into the bill detail, the coding, the clinical documentation, the medical records, and we take the time so that when we knock on the hospital's door, we're just not knocking on the door for a discount. We've got reasons for the discounts, reasons for the reductions. So those are the things we're focused on.
How is technology impacting your work?
I'd say it is and it isn't. It's a yes or no answer, yes and no answer. From a yes perspective, we're still more involved in leveraging our knowledge, our medical knowledge into technology platforms versus creating them. For example, we were recently retained by a national employee benefits firm who has their own analytics platform, but they're just not getting enough productivity out of it. So they're bringing us in to be their partner in looking through the data so that they can achieve better opportunities with care management with their members and prevention programs. So we're excited about those applications for technology where we're providing the medical knowledge resources to make technology more effective. On a no perspective, I don't see artificial intelligence replacing our physicians and nurses anytime soon, nor would we want that. We always are looking for technology to improve efficiencies and productivity, to possibly make our nurse time and our physician time more productive and more focused on patient outcomes, in terms of care management interactions and the time that physicians have to spend on actual billing issues rather than mundane tasks. So we're interested in technology from those perspectives.
So what benefits have you seen so far from being an AROC member?
Well, I think it's been hard for all AROC members of the last 2 years. It's been very difficult. We're trying to take a very balanced approach with AROC from the perspective of giving as well as trying to, take. So I'm a member of the communications committee, And my colleague, Kristen Light, she's a member of the membership committee. So we're trying to give back. From the other side, we've received some great support from AROC leadership and AROC members. So it's been balanced, and we're really, looking forward to 2022 when we're able to meet in person more frequently and come to membership meetings and conferences.
So have you had a chance or an opportunity to meet and chat with other AROC members, either within your industry sector or in general?
I did attend the annual AROC annual meeting that was in this room, actually. There was 20, 25 great people to meet. Partner Source hosted a wonderful event thereafter, and so I had a chance to meet some folks through that. But again, we all know what we've been through the last 2 years, and we couldn't be more proud to be an AROC member. We're very excited about our association and the work that AROC does, and just looking forward to the coming year.
What has been your impression of AROC and the organization's efforts so far?
Well, I think the organization is just outstanding. From a trade group, from what you get from a trade group, the resources available, the website, the communication meetings, all the different committees that AROC commits to, and just being that that unifying force for Texas injury benefit plans. It's an impressive group, and we're excited to be a part of AROC.
What are your impressions of QCare?
Well, I think QCare is an outstanding program that adds a layer of uniform standards for Texas injury benefit plans that add an additional layer in it that, combined with the protections under ERISA, it's an outstanding program. I think everybody who's connected with Texas injury benefit plans and AROC should go to the QCare.org website. It's an exceptionally well done site with information, gives you all the details you need to sign up and be a designated QCare participant. It's a free designation, and just an outstanding service that AROC's providing.
Well, thank you, Scott.